Hey, it's Dr. Jim. Thank you for stopping by. I'd like to share with you something I've been thinking about throughout this COVID-19 outbreak, and that is that healthcare providers are actually superheroes. My family and I have been taking a lot of time to watch all of the Marvel movies all over again, and it's been a lot of fun. And I've always loved comic books and superheroes and things like that my entire life, especially as a kid, of course. But it inspired me, all these movies inspired me to really think about deeply the doctors and nurses out there and other healthcare providers and professionals who are just doing heroic work. And then I thought about this crisis and then other crises throughout American history. So when 9/11 took place, special people, including police, firefighters, and EMTs, all rose to the task of sacrificing their lives for other people. They ran into buildings that were on fire and they worked around the clock to do their part during a time of crisis. Now, the COVID-19 outbreak to me is kind of today's 9/11 in many ways. And the people on the front line are doctors and nurses, lab techs, public health officials, administrators, nursing assistants, and those who are manufacturing needed medical equipment and providing telemedicine. There's a lot of folks out there. These are today's heroes. And they've always been there. This is a time in history for us to really stop and reflect. Healthcare providers have always been heroes, but it occasionally does take a crisis every now and then to fully appreciate what they do and what they've done for decades in our great country. COVID-19 is not the first dangerous epidemic in the United States, although it is very serious and it is deadly, and we have to take it seriously. America has dealt with infectious disease since the time the Europeans first set foot on the new land. And I did a quick timeline here that I think you'll find interesting and maybe put things into perspective. Doctors and scientists battled the smallpox outbreak. Do you remember that? As far back as the 1600s. Yellow fever. When's the last time we heard those words? Yellow fever killed over 5,000 people in Philadelphia in 1793. Cholera, do you remember that? Killed 5 Americans every day from 1832 to 1866 and is responsible today for 130,000 deaths worldwide. Scarlet fever was a terrible bacterial infection afflicting mainly children. Matter of fact, 95% of the victims were children. In the late 1800s, almost 11,000 Americans die annually due to typhoid fever, and they died. And the Spanish flu was even far worse. The Spanish flu killed almost 700,000 Americans. And it didn't stop there. The Spanish flu mutated years later into what became the Asian flu and took another 70,000 lives. Diphtheria, polio, measles would all cause significant health problems as well as death across our nation. Now, cryptosporidium. That was the parasitic disease that contaminated the water in Milwaukee many years ago, inflicting and infecting over 403,000 people and causing more than 100 deaths. Whooping cough, or pertussis, as it is scientifically called, is a highly contagious disease that broke out in 2010, then again in 2014. And among those infected, 10 infants died. Very sad. The CDC reports that this will return actually every 3 to 5 years, and pertussis or whooping cough is considered the new norm. AIDS and HIV killed over 32 million people worldwide and around 700,000 people here in the United States. And currently there are 1.2 million Americans living with HIV today. And the disease continues to infect people. In 2019, almost 38,000 people were newly diagnosed with HIV. So here's my point. We have a new battlefield. Today's hospitals, clinics, nursing homes, they are the front line for COVID-19 crisis. Healthcare providers and professionals literally risk their health, their well-being, physically, emotionally, spiritually. This could really, really drag you down. And even they are risking their very lives to help others. These people chose to be doctors, they chose to be nurses because of something inside of them that wanted or needed to care for other people. Even during their early years in med school and in training, they knew that there would be times of crisis. They knew that we would have big problems in our country. And they also knew that they had to be ready to deal with it. So, on these new battlefields, heroes are rising again and their character is being revealed once more. Leaders are emerging to fight this virus, get patients the help they need, and in many cases, they're saving lives. Let's not take healthcare providers for granted. Not everyone is cut out to be a doctor, a nurse, a nursing assistant, a pharmacist, and so on. The next time you see them, thank them. I'm Dr. Jim Collins, and I thank you for being on the battle line, the front battle line of the COVID-19 virus. If you're a healthcare professional, God bless you, take care. And if you're not, don't forget to give these people the respect and the thanks that they deserve.